who are participating. We're going to talk about sharing our story, and help folks, although many of you may already know how you can research your members of Congress. And then we're going to really go into a deep dive on the asks that we're going to put forth to your members of Congress. Next slide. So here's the team. You all know me, but this is my amazing colleagues that are helping us with this Advocacy Day, Respiratory Advocacy Day. For those of us who were together in New Orleans in March, and I was leaving for Advocacy Day, I promised you guys that we would get to you. And so we are here. So I'm super excited that the team, we could collaborate together, and we are here, and it is happening. So I'm going to ask each of my colleagues to introduce themselves, and Erica, I'll start with you.
Thank you. Hi, everyone. I'm Erica Sword. I'm the National Assistant Vice President for Advocacy. So I oversee all of our federal policy and advocacy on lung health and lung disease issues, and have been here at the Lung Association for 17 years. So good to see a number of familiar faces and look forward to meeting all of you very soon.
Great. Lauren?
Hi, everybody. I'm Lauren Buckley. I'm with the Lung Association. I've been with the Lung Association for about 7 months now, but I work with Erica on oxygen, and I've met a couple of you on the call. So hello again. I'm very excited to help with RAD this year, and excited to work with all of you who have not met.
Great. Ajna?
Hi, everyone. I'm Ranjana Kapil. I'm the National Senior Manager for Advocacy. I've been with the org for about 5 years, and my advocacy portfolio encompasses public health, funding, lung diseases more broadly, including COPD and asthma. And I'm really excited to meet you all in just under a month.
Great. Rebecca?
Hi, everyone. I'm Rebecca Legria. I'm National Coordinator in Policy. I've been with Lung for a year now, and I work with asthma and healthcare, and I'm just really excited to meet every one of you today.
Great, thank you. And Joanne Kramer is our colleague who's not on the phone, but she has been handling all the logistics for our meeting, and she's made the room reservations. So you may have the opportunity to meet Joanne on the next call, but I wanted to just introduce the team. So next slide. Let's talk about our timeline. The next slide. So as you know, we are staying at the Westin BWI Airport. Some folks are coming in on Monday because of the extended trip. So this doesn't necessarily apply to you on the timing of coming in Tuesday, but you know, those of you that are coming in Monday, the hotel does offer a complimentary shuttle service. They do from the airport and also from the Amtrak station. If you want to use that service, I'm going to send it to you separately in an email again, but that's the phone number that you would call when you get to baggage claim. If you don't want to do that, you absolutely can use a cab or an Uber or a Lyft. And as in last time, just always keep your receipts so that we can reimburse you for any out-of-pocket expenses. And as a reminder, which I'll say a couple times, is we can only tip up to 20% for any meals, and definitely on a cab or an Uber. So again, offered BWI, the Westin does offer shuttle service if you want to use it. Next slide. We are going to have a dinner again like we did last year in March. So the dinner is optional. I know some of your flights are coming back at a little different time, but it's really just going to be a time for us to get together and socialize and catch up and get familiar with those we may not have met from who were not in New Orleans. That is also all of our meetings, all of our meals are very confined. So it's going to be a lot easier to get around and to be together. That is in Salon B at the hotel, and we're going to do that at 6 p.m. Eastern time on Tuesday evening. Next slide. So I would like to go right now and have each of you spend 30 seconds. I'm going to start my timer, okay? 30 seconds to introduce yourself, say where you're from, and talk about why you are interested in participating in our Advocacy Day. John, I'll start with you. Maybe John, how about, I see.
John's, I see you were talking and we just can't hear you.
Maybe he's muted.
Yeah, he looks okay. Well, let's go ahead and go. Carol, I'll let you go next. And John, if you find that they're off mute, go ahead and introduce yourself. But Carol, I'll go to you next.
I'm Carol Rubin. I live in Cliffside Park, New Jersey, right over the George Washington Bridge from Manhattan. And I grew up in New York, so I consider myself a New Yorker. I was diagnosed with COPD with emphysema in 2014 and really became more active in 2017 as an advocate. And I'm really involved with raising public awareness and getting the funding that is deserving of a disease that is the third or fourth place in cause of death after heart disease and cancer. And many people don't even know what it is, so COPD. So I'm an advocate in any way I can be for the cause.
Thank you, Carol.
And
Jean. There you go, now? John. We hear you, John. You're up.
Okay. No, my microphone had switched to anyway. John Linnell, live in Wisconsin, diagnosed in 2005, left the workforce in 2011, very involved in advocacy. I enjoy going to Washington and speaking to our officials and most likely the staff members. They're the ones to make good friends with. And I'm just delighted to be here, delighted to be on board and support the American Lung Association and COPD.
Great, thanks, John. Valerie, I saw you earlier.
Hi, I'm Valerie, and this is my husband, Glenn. Because I'm an attorney, of course, I do advocacy, but I started doing lung advocacy from 2000 when I was diagnosed with emphysema from no known cause as a never smoker. My husband also has asthma, so he definitely gets the lung piece, especially since we're having to carry bigger and more different ways of oxygen supplementation when we travel. And we live in Hawaii.
Thank you, Valerie. Jean.
Hi, I'm Jean Ramos. I live in Iowa, where it is now 102 officially. So I'm staying inside and use lots of oxygen when I do go out. I've been involved in the Legislative Hill Days with the COPD Foundation, the ALA, for a number of years now. It's something that I'm very passionate about. Always try to make sure that I'm available to talk about the current issues that we're having, and this issue that we're going to the Hill with this time in terms of oxygen and access to oxygen, access to adequate oxygen and appropriate delivery methods is really important. It's something that we really need to make people understand and understand exactly what it's like when you don't have those kinds of things. So something I'm really excited to do.
Thank you, Jean. Thank you. Karen, I see you're on the line.
Okay, can you hear me now?
It's echoing a little bit.
Okay. Is this better?
Yes.
There's feedback though. I'm hearing feedback, and I don't know how to stop it.
Yeah, it's echoing a little bit.
I'm not sure how to stop it. My phone is not on.
We can come back. You know what, Karen? Once we can come back to you. I'll reach out to you when we start the presentation. I can come back and I can have you introduce yourself.
Yeah, I don't know how to stop the feedback.
Yeah. Okay. I'm sorry about that.
Sorry.
That's okay. Thanks, Karen. And we have a new friend joining us today. Mary, I would like you to introduce yourself. Mary has been working with us on some oxygen initiatives, and we thought it was really exciting to have Mary join us.
Hi, thank you. Yeah, so my name is Mary Kitlowski. I have primary ciliary dyskinesia, which is a genetic defect, essentially, which has caused lung damage. I have 30% lung capacity. I started supplemental oxygen 9 years ago and started a nonprofit to raise awareness of lung issues and particularly supplemental oxygen, and it's called Running on Air. And excited, just as an FYI for everybody, we have a meeting tomorrow morning with the FDA that several patient advocacy groups are participating in to discuss issues around portable oxygen concentrators.
Great.
Thanks.
Great, thank you. And I do not believe that Mike is on the line. So let's go to our next slide and have our asthma folks introduce themselves. I know, Jojo, I think I saw you just join.
Yes, I'm here. I'm having to put the phone up to my ear because my volume is low. But hey, everybody, I'm sorry I'm late joining in. I'm actually in another meeting at the same time right now, but I'm guessing that we're just doing introductions. I'm not
Yes.
really up on
Yes.
what's happening here right now.
Yeah, you're just introducing
Jojo
yourself.
O'Neill.
Where you
I've been with the PAG since before its inception. I started locally in the Central Florida area on the Leadership Advisory Board for the American Lung Association. And once the executive director found out that they were going to be starting up a patient advisory group nationally, she suggested that I interview for it, and the rest, I guess, is history. I've been a part of it ever since, and I just see how much growth we've made and how much progress we're making and learning how to incorporate the patients into what's going on with the airways clinical research centers and the researchers and clinicians, and it's rewarding work, and it really, for me, makes me feel like I'm making a difference. I also have my own nonprofit organization called the Let's Kick Asthma Foundation, and basically we are patient focused. We assist patients with whatever they need. We don't offer medical advice, but we are an organization that offers support groups. We offer outreach services. We offer financial assistance to whatever for whatever an asthma patient may need. Anything outside of the medical field or the medical requirements, we try to be there for them as we kind of figure it all out. And I guess that's basically me. I for a living, my career is a radio personality. I've been a radio personality for 39 years. I work part-time in television, so I guess I'm a broadcaster. That's about it. That's my story.
Thank you, Jojo.
Okay.
Michelle B., I think you're on the line.
Yes, I am. Hi, my name is Michelle Bedell. I was diagnosed with adult onset asthma in my 30s, and I have 4 children, all with varying levels of asthma, some quite severe and some pretty mild. So I have a lot of experience with being the patient and being the mother of the patient at the doctor's office, and with all of the fun and joy that comes with small children who can't communicate, trying to breathe in the middle of the night.
Mm-hmm. Thank you, Michelle. Michelle D. Silva.
Hello, everybody. I've been on the PAG for a few years now, but involved with the ALA probably, I don't even know, Annette and I can't figure out how long we go back. Long time. I have had asthma since childhood, and it's ebbed and flowed, and categorized at this point as a severe asthmatic on biologics. I also am a respiratory therapist of 33 years, it's a couple of people call me a hybrid. I'm a patient and a healthcare provider. Great. So stay up to date on just about anything.
Great. So, thank you,
Michelle. Look forward to, this year and being involved in Capitol Hill again.
Thank you. Thank you, Michelle. And I do not believe that Renee is able to join us today. So I think those are the key players. So welcome, everyone. We're going to go to the next slide. We're going to just briefly walk you through the agenda of how things are going to happen. As I mentioned, everything is located at the Westin, at the BWI Westin, and we're going to be in the same room, so there's not going to be a lot of traveling back and forth. Breakfast is going to be available for folks between 8 to 9:45. We're actually going to start the training at 10 a.m. We're going to go through, we will have lunch, and then we'll have a little bit of a break, for lunch, and then we'll do training. We'll pick up again between 1 and 3. We'll have a half an hour break. And then one of the very cool things that we're incorporating this year is after we do our training, we're going to have a roundtable discussions with patients and the folks in the room and our funders, those individuals who've helped us bring Advocacy Day to fruition for lung disease patients. So more to come on that. I will kind of give you sort of a general idea of the type of discussion points that we're going to have, but we'll follow up with you on that later on. And then we are going to have just a brief reception and dinner to follow. Again, everything's in the hotel. We hope that the schedule is going to accommodate for everyone, but that's kind of the general gist of Wednesday. An important reminder, if your spouse or your companion has registered to participate in your Capitol Hill visits, they need to attend this training with you, because we're going to talk through the steps and the messaging, and we want to everybody have the same training. So if your folks if they are not coming to Capitol Hill with you, they do not need to attend this. But if they are coming, they must attend this training with you on Wednesday. Okay. Next slide. So Thursday itself, we do have a bus that's going to pick us up at the hotel. It is an early day. And so when we say that there's going to be a lot of breaks in between, we're just kind of giving you the rough schedule of what to anticipate. I'm going to have the bus is going to pick us up at the hotel at 8 a.m. So breakfast is at 7 a.m. And then we're driving down to DC, and we're going to be dropped off at an office that the wheelchairs are going to be. I do have wheelchairs for those individuals who have requested them. They're going to be at that office. So we'll have access to them all day. When we say, and we're going to get a group photo in front of the Senate fountain. So super excited about that. When we say visits are from 9:30 to 5 p.m., that does not mean that you're going to be going all day for those visits. There's going to be times in between. As you know, we are at the mercy of the luxury of our members of Congress of their schedule. So if you've done this before, that sometimes it could be up to 48 hours that the schedule may flex, but you are not commit. Can you guys hear me? I think Karen said she could. Okay. She said yes, that, but you are not committed to being on the go from 9:30 to 5. I just want to make sure you're aware of that. We're going to give you places where we can go to eat. There may be places where you can obviously rest and do some things in between, but that's where the schedule is. And then we're going to depart back to Baltimore. Now, Thursday night is when the ACRC and our friends with the ACRC is going to be there. So it is optional. If you want to come to the dinner with ACRC, you can. If you just want to get takeout or get something in your room, that's understandable as well, too. But we're planning to have dinner with the folks with the ACRC on Thursday evening back at the hotel. Okay, next slide. Again, this is just a reimbursement. Again, you remember the routine with finance. We just need to make sure that you keep your receipts, and we can't tip more than 20%. And I will give you that form again in advance. And actually, that day we can walk through it when we're in person. Next slide. Friday. Again, this is some folks, depending on when you are leaving. The only thing that we really do with the steering committee is that we're going to have breakfast with the group, and it is at 8 a.m. And then the steering committee is from 9 to 5 a.m. that day. Dr. Wise has put us on the agenda for 15 minutes that we can give them an update on the great work that we are doing and kind of a recap from Advocacy Day. So post this call, we can connect and collaborate on how we want to present that. But we do have the opportunity, and we are going to use that as an opportunity that day to mobilize the researchers and the investigators and the team to also take actions on our legislative call to action that day. So we're going to get some fun excitement going on. So we are on the agenda for the steering committee meeting, and it's first thing in the morning. The next slide. Again, different people are departing on different days. It ends on Friday, but some folks have chosen to stay over Saturday evening. So depending on when your departure is, Again, the only thing that you're responsible for is when you check into the hotel, you have to present a valid credit card. They will not charge you for your room. They will only charge you for any incidentals. There is not a fee for parking for those who are driving. It's an open parking lot, so you won't have any charges for that. But if you stay Saturday or Sunday, those will be additional charges for folks. But you know who you are that's planning to stay those additional nights. Next slide. So I've had many of you, we've already worked on this. I think all of your stories are online, but one or two. Next slide. There's two folds to this. There's three different versions of your story. I'm going to talk about the one that's online because we do showcase our patient advisory group members, and it really gives folks the opportunity to help raise awareness and offer hope to those who've been diagnosed and maybe going through a similar journey. So we want you guys to start thinking about your story, perhaps what has inspired you and what is most important for you and your loved ones and why you want to participate in this Respiratory Advocacy Day. I shared the link with you in my email yesterday, but I'll share it again. You can look at your story, and if you want to make any additions to your story, please feel free to do so. And then Lauren's going to talk to you a little bit later in the presentation about your story composition and story presentation when you're meeting with your members of Congress. Next slide. Now I'm going to pass it over to my friend Erica, and she's going to talk through the asks.
Hi, everyone. I got to say, I'm really excited that all of you are coming to town and just want to say thank you. I know a few of you, and I have heard about the rest of you, the legends of advocacy. So I'm really excited to have you all come in and for us to focus on respiratory health issues for a day on Capitol Hill. So very eager to do this at a really important time. So next slide, please. So before you all come, I know most of you know all of this information, but please do a little bit of research on your members of Congress, who they are, what their political parties are, what committees they're on. Have you seen in the newspapers or in any sort of online articles recent comments about government funding and a potential shutdown, either pro or con? Unfortunately, we seem to have some folks right now that are in favor of having a shutdown. And kind of just to get a little better sense of all of that, maybe you've written them letters in the past about a particular advocacy issue, and you know that, for example, they've said good things and they care or have a connection to asthma, or they've understood some of the challenges associated with supplemental oxygen. So any sort of background you can do before you come or that you have, we can talk a little bit more since this is a smaller and more manageable group to do a quick download, especially on the senators. But any kind of background you have will just make you that much more powerful. Next slide, please. So in order to find out that information, you can either go to congress.gov and click there. You can also, for your House member, if you were not sure who she or he is, you can go to just house.gov and type in your zip code and go there, and that will also get you the information, and you can find your senators and everyone else there too. So just see what you kind of homework you can do about all of that, and if they've issued any press releases and on a particular issue or on healthcare issues in general. Next slide, please. So we're going to have kind of two main asks for Respiratory Advocacy Day, and Ranjana and I are going to go through those shortly. But we also really recognize when you all are coming to town. And that is 9 days before the fiscal year of 2024 ends fiscal year 2023 ends for the federal government. The new year begins for the feds on October 1st. And we'll talk a little bit more about this. But what we know is that if we are going to have the types of investments in both public health at the Centers for Disease Control and Prevention and biomedical research at the National Institutes of Health, we really need robust, predictable, and sustained investments. It is very hard to budget if you don't know how much money you are going to have to spend. And that is very true for each of us, but that is also very true for these vital public health institutions in our nation. So we're going to talk a little bit about that. We are going to ask members of Congress, at least on the House side and maybe on the Senate side, to co-sponsor the Family Asthma Act. And Ranjana will go through that a little bit more. And then we're also going to talk with members and educate them about the importance of supporting legislation to reform supplemental oxygen in Medicare. Next slide, please. Next slide, please. So let's talk a little bit about funding. Why do we care for it? Every year, Congress has to decide how much money each program and each institute at NIH and CDC are, how much money they're going to get. This is not something that happens like clockwork, like with Social Security and Medicare. And we really know, based on what we've seen with COVID, how some of you know that we've only recently been able to get a program at CDC for COPD, which is insane, but we've gotten it. And the Lung Association was really proud to play an important role in all of that, as well as make sure that there is sustained investment in the asthma program as well. And so we've really seen a steady increase in funding for NIH and biomedical research, but that's now in jeopardy. And we've also seen this chronic underfunding of CDC. So you all are great. All of us are great living, breathing examples of why we all need investments, so sustained, robust, and predictable funding for both CDC and NIH, so that we can really prioritize health, because we know how front and center that has to be for our nation. Next slide, please. So just to talk, and we talked a little bit about this, we know that it's much more complicated. This is the kind of the beginning version of, and the top level version of why COPD and lung disease and asthma at both NIH and at CDC are focused. But we wanted to just give a very high level overview, and I think that is sufficient for our Hill Day in terms of what happens. We know how many different institutes at the National Institutes of Health do lung health research, and how collaborative and overlapping it is. And so we're talking just in general about the overall CDC and NIH for our discussions. Next slide, please. So as I said, we are racing against the clock right now. There was a deal in June to raise the debt ceiling, because we were, as you will all recall, about to forfeit and on our national debt. And Congress reached a bipartisan deal, and President Biden signed it into law. And the deal was to keep funding for this fiscal year at last year's levels. But unfortunately, the House has reneged on that deal. And they, many of the rank and file members want to take it back to 2 years earlier, which would really have some devastating consequences, as you can well imagine, for CDC and for NIH research, right? That kind of progress cannot happen if we're going backwards on funding. But the Senate is in contrast with that, and a lot of the House members are in contrast with that too. But August came, and everybody went home and came back to you all, which we're never sad to see when they go home to you. So in hopes that you can talk some sense into them. But we are now on a crash course for September 30th, when the government funding is set to run out. We're facing the very real possibility of a government shutdown come October 1st. So next slide, please. So we have stark contrast here, right? That we can have this barren, destitute federal government that does not make investments in public health or in biomedical research, and is really leaving its people hanging. Or we can have a good investment, sustained, robust, and predictable investments in research and in public health investments. And those are really the two stark contrasts we have right now. And so one of the things that we want to do is, we're going to just touch lightly on this with our Lung Cancer Advocacy Day in the spring. We go into a lot of detail with this. But what we're trying to do is just to do a very high level overview, reminding Congress that that government funding runs out in about 10 days once you get here. And we need them to do the right thing for investing in health for the entire nation. Next slide, please. So this is our ask. Please support robust, predictable, sustained investments in CDC and NIH to improve our nation's lung health. So I'm going to put a pin in and just ask any of you who have questions to either put them in the chat now or just jot them down, and we'll come back and answer them at the end. But I want to keep going forward with the other two asks. So with that, I'm going to turn it over to Ranjana. Thank you.
Great. Thanks, Erica. So our next ask is related to asthma. Next slide. Specifically, we're going to ask members to please co-sponsor the Family Asthma Act. So we have been working with Congresswoman Dingell from Michigan to introduce this bill, and there is a plan in place to get this bill introduced before RAD. So fingers crossed. Some of it is not in anybody's control. It's in the LegCo's in control right now. And then we're also working to introduce the bill on the Senate side, but as of today, there is no guarantee that that will happen before we all meet in a few short weeks. We will have more information, but I'll reserve to share that when we all see each other in just 4 weeks. Next slide. So as you all know, and what we want to convey to Congress is that asthma is still this very serious and costly health issue in our nation. It's not this passive or okay disease that kids have where they just need an inhaler. No, it's more serious, and many of you on the call know that, whether it's that you have asthma or you have kids that have asthma, you've experienced it. More than 25 million Americans have asthma, of whom 4.2 million are kiddos. Asthma is the leading cause of hospitalizations and school absences among kids. There is a pretty massive economic burden associated with asthma, as you see on the screen. 50 billion annually in healthcare costs, 3 billion in missed school and work days, and 29 billion from mortality. And we know, and I know you know, that asthma mortality can be prevented, but unfortunately a lot of people in the US still die from this disease. There's also a health disparities component to asthma prevalence. Specifically, what the data shows is that Black and Indigenous communities, Puerto Ricans, and people of multiple races have higher asthma rates compared to other races and ethnicities. And data also shows that Black Americans are 30% more likely to have asthma, and they're also 3 times more likely to pass from asthma than white Americans. And so, of course, you don't need to have all these facts memorized before you go into your meetings with staff or members. Typically, it's best if you just pick one of these facts, really, to integrate in your story. So you can pick one that fits best, depending on who you're meeting with or how you're shaping your story, which one really fits well. So definitely don't have to have all these memorized. Next slide. Given that asthma is still this massively prevalent health issue, it's really important that we have the CDC's National Asthma Control Program. So this was a program that was founded and created in 1999. Currently, the NACP funds 23 states, Houston's, and Puerto Rico. And if you go on the NACP's website, you can see if your state is funded. And whether it is or isn't funded is always a good thing to bring up in your meetings, so definitely be on the lookout for that. The NACP has a lot of goals, including reducing asthma morbidity, mortality, and disparities, preventing asthma-related hospitalizations, especially among kids, promoting asthma control and prevention, and also building capacity in state programs. The work that state and local health departments do is incredibly important in reaching everybody's communities. Developing public health interventions to protect people from asthma. So this piece can really look different depending on which state is receiving funding. On the West Coast, that could mean a plan that would address wildfire smoke, which we know, of course, exacerbates people's asthma. And in other parts of the country, like the Southeast, maybe that plan includes some piece around flooding and hurricanes and mitigating the impact, because we know when the water recedes, it can leave mold, which would exacerbate asthma. So this piece can look a little bit unique depending on which state has the funding. The other very important thing that the NACP helps fund is adult and pediatric asthma surveillance. It's incredibly important for us to understand what the asthma landscape looks like. Are there clusters of asthma based on age, race, gender, geographic location, etc.? And that data is super helpful for public health professionals, for decision makers, for researchers, etc. Next slide. So we know that the National Asthma Control Program is making a difference in improving disease outcomes. Since its inception in 1999, asthma mortality rates have decreased by 41%. We've seen the number of people living with asthma has increased, but research shows that people with asthma are better at managing their disease. We've seen the number of people having asthma attacks decrease by 16% from 2001 to 2018. We've also seen 24% fewer hospitalizations due to asthma from 2003 to 2010. And this is not a coincidence. The creation of the NACP, providing funding to state health departments to work on asthma, has really helped in educating the public and developing public health interventions and collecting data. And all of that and more has really contributed to some of these really big wins we've seen. Unfortunately, there are still some pretty big gaps. 27 states still don't receive NACP funding. So that means 27 states don't necessarily have the capacity to promote asthma control and prevention at the level that's needed. That also means not every state is receiving the dollars it needs to conduct comprehensive asthma surveillance. Next slide. So this is where the Family Asthma Act comes into play. So this bill, if passed, would expand the National Asthma Control Program to serve all 50 states. It would direct CDC to collaborate with state and local health departments to educate the public about asthma. It would require the development of state plans to address asthma, particularly for disproportionately impacted communities. And it would also require the collection and coordination of data on the impact of asthma. So this bill addresses the serious gaps we have as it relates to reducing the burden of asthma, and addressing the toll of asthma really requires this comprehensive approach. And that's what this bill would do. It would ensure that states have the capacity to conduct surveillance, to develop the appropriate necessary evidence-based interventions to educate the public. And so that's why we're such strong supporters of this bill, and we really think it's a great ask for our Respiratory Advocacy Day, and we're really excited to have you all talk with your members and their staff about this. With that, I'm going to pass it on to Erica, who's going to talk about the oxygen ask.
Wonderful. Thanks, Ranjana. So with full knowledge and recognition, next slide, please, that a number of you on this call could certainly give this presentation better than I can. Let me talk a little bit about this just to make sure that all of us are up to speed and on the same page. As many of you know, we have been working very hard in the last year plus to develop a really powerful coalition and to cultivate members of Congress and champions to introduce reform legislation to really overhaul the entire Medicare supplemental oxygen industry. And so this is something that we can certainly, I'll let Jean and Mary talk about it more one night with everyone, but we are really excited to be able to put this ask into place. I'm really eager over the next couple weeks to see how much progress we're going to make around this too, so that you all can continue to hit the ground running when you come. But our ask is please support forthcoming reform legislation to ensure Medicare beneficiaries access to supplemental oxygen. Next slide, please. So supplemental oxygen, as many of you know, often is prescribed for people who have advanced or underlying health conditions. And unfortunately, about 14 years ago, Congress, recognizing that there were some really bad apples in the oxygen industry, and also other durable medical equipment like wheelchairs and scooters, that they were going to do competitive bidding in a new program, next slide please, to reduce the cost to the federal government for how much supplemental oxygen and other medical equipment cost the federal government. But unfortunately, what the consequences of this are, is that it has added significant barriers to people who need appropriate or to people who need supplemental oxygen, and has also made it very difficult for people to get medically appropriate oxygen if they need it. You all will hear from each other later on just about how horrible the systems are that in some cases literally tie people to their homes. or go without adequate saturation levels because they need to leave their homes to carry on basic life. Next slide, please. So what we know, and what is common sense to all of us, but apparently wasn't to Congress about 14 years ago, which is that when you are breathing, that is not the same widget as a wheelchair or a scooter or any of the other DME equipment that has happened. And so this really did sink to the lowest common denominator. And not only are people not receiving the type of appropriate equipment, the appropriate oxygen for them to be fully saturated and have enough oxygen coming into their bodies to breathe and have healthy blood flow, but also assistance from trained respiratory therapists has been replaced by drivers giving instructions to patients based on turning knobs. And an absolute lack of protections for patients, all of which is completely unacceptable. Next slide, please. Particularly, this is the case for people who require liquid oxygen, which really does help. It's lightweight, portable, and allows people to be on the go and to live life and still be able to breathe. And unfortunately, what we have seen and what the data show is that this very incredibly life-saving and needed modality of oxygen has all but disappeared across the United States and is exacerbated in even other places. A lot of patients and medical providers are no longer aware that liquid oxygen exists because the suppliers simply will no longer pay for it. That oxygen companies, despite needing to have provided it under law, said that it was too expensive because remember the lowest common denominator, and have just switched people willy-nilly, including some of the people on this call. That again is unacceptable. Next slide, please. So what we are doing, and then we'll turn things over to talk a little bit about connecting all the asks with Lauren, and we'll talk a little bit more about supplemental oxygen, is to come together with patients and patient groups, provider organizations, including the American Thoracic Society and CHEST, the American, with all of the AARC respiratory therapists, and also, believe it or not, the oxygen suppliers, to reach agreement on a set of principles and draft legislation. And in fact, this afternoon, Lauren and I were up on Capitol Hill meeting with an office that we very much hope will be supportive of introducing legislation. So we'll continue to keep you posted, but darn it, we're going to get this across the finish line, and we're really excited for all of you to be a part of that. So Lauren, I'm going to turn things over to you now.
Yeah, thank you, Erica. And like you mentioned, we're very excited to get the oxygen issue rolling, and we're very fortunate to have the Family Asthma Act kind of rolling down the hill as well. Next slide, please. So when we want you to practice your story, we want to have three things in mind. It's really easy to get caught up in statistics, but when you are practicing your 2-minute pitch and your 15-second elevator pitch, we want you to pick out a favorite statistic and incorporate it in with your story. It's really hard to get years of your life down into 15 seconds, but as many of you may know, you might run into your members of Congress in the elevator. It's happened to our advocates before. And we want you to be prepared if that situation does come across your lap. And it's also a great way to make your story super concise and get the real points across. So when you're practicing your story, we want you to have a 2-minute pitch for your actual meeting with your member of Congress, including your story and connecting it with the asks, a 15-second elevator pitch, and that one statistic included. Next slide, please. Here's just a quick reminder of the asks that we went through, supporting robust, predictable, and sustained investments in CDC and NIH, co-sponsoring the Family Asthma Act, and supporting legislation to reform supplemental oxygen and Medicare. You may get some questions about the support legislation piece of that ask. We do not have legislation introduced. We want people to, if they're one of our targets, we want them to co-sponsor it. But in general, we want people to support it when it does come across their lap. Next slide, please. So this is an example of a story. This is from Joan in New York. She's not one of people that will be joining us, but we thought she had a fantastic story. She was on liquid oxygen and diagnosed with COPD. She's one of those people who had their liquid oxygen taken away, despite it being medically appropriate for her. In the second paragraph here, you can see how we can connect her story being taken off of liquid oxygen and suffering from anxiety into asking to support legislation to reform supplemental oxygen in Medicare, as well as co-sponsoring the Family Asthma Act, because we need more investments in research and public health for lung disease. We need to have the proper equipment to be able to leave our houses in confidence. So that could apply to people with asthma, people with COPD, or using oxygen. And we want our freedom back. We need to be with our families, friends, and enjoy life. So just kind of wrapping it all up there. And at the end, she reiterates that our 3 asks in more plain terms. We want you guys to come up with your story, your 2-minute pitch here. This would probably be under 2 minutes. Starting off with your story and then kind of wrapping it up with our asks. Next slide, please. All right, wrapping it up here, we have a couple logistics to go through to keep in mind when you're on the Hill. Next slide, please. So we want you guys to start thinking about your story. I'm sure you've thought about it before as experienced advocates, just getting it down on paper, why you're coming to Washington and how it connects to those 3 asks. Please email me, lauren.buckley@lung.org, if you have any questions or concerns or any personal contacts in your members' offices. We're going to be handling all the scheduling ourselves, or Soapbox Consulting will be. So don't worry about contacting your members of Congress directly. We got it, and we will give all that information to you before we go to RAD. Next slide, please. So I know this seems a little early and trivial to be talking about this, but your footwear is really important. We want you guys to wear something comfortable, no heels, nothing that'll give you the need to wear Band-Aids. It seems very trivial, but your feet will be hurting, and we want you guys to take care of yourselves. Please wear business clothing, suits, dresses, ties, and flats or sneakers, and just in general, be comfortable. And it's going to be a long day, 9 to 5. You might be sitting and waiting in between meetings or need to go in between House buildings or Senate buildings that are quite far away from each other. We will reimburse taxis to get in between the two, but just take care of yourselves. Next slide, please. Also, if you do not have a business card, please let me know, lauren.buckley@lung.org. We will provide you with one. If you have your own personal business cards, bring a lot of them. You might need to hand them out throughout your time on the Hill. Next slide, please. Here's some upcoming dates. This is kind of laying out our schedule for each day. We're going to have our final RAD pre-call on Wednesday, September 13th. Y'all will be arriving on the 19th, having dinner that day, then training on Wednesday, the 20th. Breakfast bright and early at 7 a.m. on the 21st when you guys are going on to the Hill. Buses are leaving at 8, and then having your meetings from 9:30 to 5. There will be an ACRC dinner on September 21st. Oh, sorry, Thursday, the 21st, after we're back from our Hill meetings back in Baltimore. The buses will take us all back up there. And on the 22nd, we'll have a ACRC steering committee breakfast at the hotel. And everybody will be leaving then on your own time. Next slide, please. Now we're going to open it up for questions. We're going to go through the chat and look at hands. I do see Karen's
Rebecca,
hand up.
real quick, Lauren. Rebecca,
Yeah.
do you mind stopping to share the Q&A or the slide deck? And then we can just be on screen together. Thank you.
Karen, looks like you're on mute.
Okay, I can finally hear you guys. Can you hear me this time?
Yes, we can.
Oh my gosh.
Sounds
Okay,
great.
I've got, I think, 2 questions. How many of us will be considered to be a team going together? And how many elected officials' offices do you figure we will be visiting in our one-day visit? Will it be 7 or 8? Will it be 12? The first time I went in person, I think I went to 12 different offices. The second time it was 6 or 7.
Lauren, do you mind
so
if
that's
yeah,
Oh,
I'm
go
going to
ahead.
chime in here at the beginning because our philosophy is that the most effective meetings you are going to have are with the people you have a say in sending to Washington. And so we are intentionally not sending you to 12 offices, Karen, not only
Okay.
because that's a heck of a day, but also because if you went to see somebody in Ohio, they wouldn't care because you're not their constituent and you won't have a chance to vote for them. And
Right.
so we really abide by the philosophy that you're going to see your 3 members of Congress plus as many other as we have grouped you, and I'll let Lauren and Ranjana speak to that. And you'll go with your buddy or your teammate to their visits too, so that you'll have that overlap. But you are not going to do the blanketing or blitzkrieg of Capitol Hill. That is not an effective use of your time or energy.
Yes.
Good.
Yeah,
Our
12
group-
meetings is a lot. Even like Erica and I are on the Hill pretty frequently. That's a long day.
Yeah, it was. I was with it was with respiratory therapists, and we were all over the place. Yeah.
Our groups are between 2 and 3 people. And to answer John's question, I meant to touch on this during the presentation, but I believe we have 5 groups or 6 groups in total, and then half of those groups are mixed groups. So there's at least 1 asthma and 1 COPD patient. However, there's only 4 asthma patients, I believe. So there will be groups without a combination, in which case I would recommend reading up on asthma, or at least saying, hey, I know somebody else with asthma and here are their struggles, or like a sentence or 2, including in your meetings. So I hope that answers your question.
We will be providing, to add to it, Lawrence, we will be providing to you background information and talking points and things of that nature prior to your visit. So there's not an expectation. While many of you are more leading experts on COPD, asthma, and oxygen, we definitely will make sure that we have, the asks and backgrounder sheets for each of you to review.
Yes, I'm sorry. I didn't mean to say that you were going in there alone with no materials.
And for those individuals that we do have that we will be utilizing a wheelchair, we will have a staff member or someone to be with you to provide that assistance.
Good. Thanks.
Mm-hmm.
I'd hate to wheel myself.
No.
Be a fun ride around Capitol Hill, right, Karen?
Yeah.
Well, you guys know Len, what's his last name? Diver? Double lung transplantee. He wheeled me around 5 or 6 years ago.
Oh my goodness.
Wow.
Yeah. And I remember saying, you shouldn't be doing this. And he said, why not? I have the lungs of a 26-year-old. Yeah. Double lung transplantee pushing
Wow.
me. Yeah. Amazing.
Valerie, I see your
Valerie?
hand up. You're on mute.
When will we be finding out who we might be linked with if we're not just linked with the person we're coming with? Because my husband has asthma and I have COPD, so I don't know. And then the other thing is, even though I only live where I live, I have a nonprofit that serves the whole state. So normally they let me talk to all 4 people that represent our state. That's all.
Thank you. That's good to know.
Ranjana, do you want to, or Erica?
We can certainly follow up to kind of share and connect with email addresses, since this is a small enough group, that the groups that will be traveling together. And I appreciate that offer, Valerie. I think we're in all likelihood going to stick with what we've got with regard to your visits. But I do appreciate that offer, because you will be going to other visits too, not just the Hawaii delegation, but with the state that you are paired with as well. So and we will get you your teammate, or, you know, in your case, your teammates, and then Soapbox Consulting, who, as we said, it does all of our scheduling for visits, because that is a full-time job. They will be sending you your schedules about a week before. However, please know that even though you have a break at 2 o'clock, let's say hypothetically, please don't plan on doing anything else at that time, because the schedules are such that they can be moved around and reorganized at any time. And we're just going to hang out and be flexible there, because things can change right up until the last minute, and often do.
I also saw you guys asked if you're getting a copy of the Family Asthma Act. Ranjana, are we including that?
We are still waiting for it to be finalized a little more. It's very much in draft form. So once it's finalized, I am happy to share that.
But we do have one-pagers and backgrounds for the Family Asthma Act, as well as the supplemental oxygen legislation. And frankly, that makes a heck of a lot more sense than what you see in legislative language.
And will the people we're meeting with get these things in advance of us coming? Or are we supposed to carry these things, or how does that work?
So everybody will be getting folders for each visit, and those folders are going to hold those one-pagers around our asks and some background information. So the staff, you will be giving that to the staff. Before our meetings, though, the staff will be receiving information with our 2 big asks around asthma and oxygen. So they will be aware of what you're coming to meet with them about.
Okay, that's good. That's good.
John, we see your hand.
Me?
Yep. Yeah.
No, sorry. Yeah, and that's I appreciate Valerie's question, because, you know, instead of leave behinds, it's good to always have the send aheads, because that way they're somewhat prepared and they have at least somewhat of an idea. But I just wanted to comment, because earlier there was a mention about the distance between, for example, the Senate side and the congressional side, and you're talking about taxis. There is a somewhat private underground subway that goes between them, that is reserved for staff and House members. But if you say and ask, can you have an escort accompany me? Because I've done it before. Yeah. They will gladly take you from one side to the other. And I've ridden on the private
subway.
Subway.
I appreciate that, John. I will say that I will certainly encourage people to go and use the tunnels to walk on the House side and the Senate side. But since the Capitol has opened up again after January 6th and after the pandemic, it is very difficult to even have staff escort you from one side to the other. So I would not count on that being possible anymore, just because of everything that's happened.
Yeah, it's been a few years, but
yeah,
I thought it was really sweet. And
it is. It is very nice.
I'm
Let me
jealous.
tell you,
I've never been.
On many a cold day, I have greatly appreciated that. But unfortunately, that's just not really doable anymore.
Yeah.
And just also, I wanted to add that those that have not been to the Hill before, often you will meet with the staffers, not the elected official. But you know what? That is better, because they're the ones that have you sell them on the ask, and they're the ones that will have the elected official's ear at the end of the day. you meet with the elected official, they're going to glad hand you and they're going to want your vote. And it's good to see you. Thanks for coming down. And believe me, I've been there enough. I know how it works.
One thing in a note, and then we'll get to the hands, is we will also give you like a map of the buildings and like different places to go and where to go. So we will, for those newcomers to DC, we will prepare you and walk you through that. So I see JoJo's hand and then Valerie's hand.
Okay, so when we're preparing like our 2-minute elevator speech, how do we incorporate? Are we incorporating all the asks or the asks that are specific to our conditions, or how does that work? That's my first question.
We would appreciate it if you are able to incorporate all 3 asks. You will be with a team, so there will be time for you all to practice how you want to share your stories together. And if one of you, it's more relevant because you have asthma, for you to make the asthma act versus somebody with COPD to make the oxygen ask, you guys can kind of figure out how you want to integrate and incorporate those asks that way.
Okay, kind of like a WWE tag team match. Okay, gotcha. And then my next question. Back down. And my next question is concerning, I heard someone mention nonprofits. I was advised by my accountant with my nonprofit that I really should not, or it would be in some sort of violation, I don't know, to even mention that nonprofit. So I hadn't planned on doing that. Is that true? I mean, because like I said, I heard someone mention a nonprofit a little while ago, and the fact that we cover a wider area other than just who made the people who represent us in our areas. Because my nonprofit, we are on Zoom now and it's national, so.
Yeah.
I
really appreciate that question.
I shouldn't mention it. Yeah.
Yeah, I really appreciate that question, JoJo. I think under the auspices of you all coming for these 2 days in September to be with us, we really appreciate you being part of the American Lung Association extended family of volunteers and advocates. And so that is that's why we invited all of you here. Because of your involvement with the American Lung Association. And so we just appreciate you wearing your volunteer Lung Association hat while you're in town. So Annette, I'm not sure if you wanted to add anything to that.
Nope, that was it. I was told to, just not to mention anything about my personal nonprofit, and I hadn't planned on doing that anyway because I realized the capacity with which I'll be there with the American Lung Association, and I'm looking forward to it. My first time.
Awesome, JoJo. We're really glad you're coming.
Thank you.
Thank you, guys.
Valerie.
Yeah, I'm just wondering, do the wheelchair pushers know the route, or are we supposed to direct them? Because that was my main reason, other than being breathless, for wanting a wheelchair pusher.
So
I'm hoping that they're gurus.
In our logistics call that will take place a week before we all come to DC, we'll go over kind of how the House and the Senate buildings are laid out and the tunnels and everything. So it's pretty self-explanatory once you get there because all the signage is there and whatnot. So we will make sure it's very easy to follow and to understand how you navigate.
So do they know or do they not know?
Yes, they will know.
Yes, they will know.
Yes. Yeah.
Yeah.
Thank you.
Mm-hmm.
Any more questions? Thank you guys so much for your engagement. I really appreciate this.
These are great questions. And number one, you have plenty of time to ask questions, and we are going to have another call a week out to deal with logistics, and then we'll have the training the day before where we'll do some role plays and we'll have you all together with your groups. And so please don't think that this is the very last time that you can ever talk to us.
Oh, Karen.
Annette, since I could not hear you the first half hour or so of the call, and I know it was being recorded, is there a chance you could send me or somebody could email me the recording so I could hear what I missed?
I'm
Thank
going
you.
to, yeah, absolutely. I'm going to send everybody a PDF of the PowerPoint. We'll send everyone the version of the recording. So yes.
Okay,
Great,
now
thank
I'm
you.
trying to lower it here.
Now, and again,
Control-Shift-K.
I'm going to have special eyesight on the temperature of the room. I don't know if you all are going to bring your blankets back, but hopefully the room won't be as cold as last time.
I love that blanket.
Good,
I absolutely
good.
love that blanket. I want another one. Keep
Yes.
the room. No, I shouldn't say that. Don't make the room that cold.
Yes. John,
Well,
I'm sorry, go ahead.
Just real
this is
quick.
Midge. Oh,
Hey,
go ahead.
Midge. Hey,
Hi,
Midge.
guys. I'm here. This is Midge. I appreciate the opportunity that you're giving us, and I will be there, and I will do my very best to get this across to the Congress.
Oh, thank you, Midge. And again, we will be sharing the PowerPoint and the audio with you. So thanks for joining.
Thank you.
Looking forward to seeing you.
Thank you. Looking forward to seeing you all.
Mm-hmm.
And just I just need the slide as far as when the next meetings are taking place, because I'm going to be out of the country for about a week just prior to this happening, and I don't want to miss anything.
John, I expect you from all of your excursions that you're going to be calling in on your excursions, right?
Well, I'm going to be
on your cruise.
I'm going to be at ERS.
Yes, your cruise ships. No, I'm teasing you. Absolutely.
No, ERS. I wish it were a cruise. It's a
yeah. I'll send all that to you by tomorrow because we'll have the recording link by tomorrow. So by tomorrow, I'll follow up with everyone.
All right.
Great. Thank you all so much.